This podcast is brought to you by The Senior Techie, a source of information for seniors and others about technology. Welcome to the Senior Techie podcast. Today, we need to talk about something that might explain a lot of that frustration you might be feeling with modern healthcare. You know, that feeling when a health app or maybe a new device, it just doesn't seem to get you, like it was built for someone else.
For someone 30 years younger.
Exactly.
It's a very valid frustration.
Yeah.
And according to the insights we've gathered, it's not just in your head. There's a name for it. It's called digital ageism.
Digital ageism, that sounds intense, but it makes a lot of sense.
Right.
We usually think of ageism as, being dismissed at work or socially, but the senior techie points out this bias is being written into the code itself.
That's the core of it. The senior techie identifies this critical issue where AI and medical devices are often systematically biased against older users. It's not just that the font is too small, though that is a problem. It's that the actual algorithms, they're creating a cycle of health inequity.
Okay, so let's unpack that. Because I think most people assume that technology is neutral. Math is math, right?
You would think so.
But the senior techie says it starts way before the app is even built. It starts with what they call the data gap.
Right. So think about clinical trials. When researchers are gathering all this data to train these AI models, who do they usually recruit?
They want clean data, I think is the term. People without a lot of other health issues.
Exactly, without complicating conditions. But if you're 70, you might have high blood pressure and arthritis. To a data scientist, that's noise.
So they just exclude you, the very people who need the technology the most.
Precisely. And the senior techie explains that if an algorithm is trained almost entirely on data from 30-year-olds, it learns what normal looks like for a 30-year-old.
And then when you apply that to someone who is 75...
it performs poorly.
Yeah.
It's like trying to fit a square peg into a round hole. The math just doesn't work.
And reading through the material from the senior techie, you can see this creates a really nasty feedback loop, doesn't it?
A very vicious cycle.
Because the tech doesn't work well for seniors, the researchers then claim, seniors are too difficult to include in our trials, so the data stays biased.
And the technology keeps failing that group. It reinforces the stereotype that technology just doesn't work for older adults. But the reality is the technology was never built for older adults in the first place.
Okay, so that brings us to the part of the report from the senior techie that I found. I found it the most shocking. It's about how these systems decide who needs urgent care.
The proxy measurements.
Yes.
This is where it gets really interesting and, frankly, pretty concerning. Algorithms often can't see medical need directly. So developers tell the AI to look at something else as a stand-in, a proxy.
And that proxy is spending patterns.
Spending patterns. The logic is, if you spend a lot on healthcare, you must be very sick.
But wait a minute. Historically, our healthcare systems often spend less money on older patients for the same conditions, right?
That's the trap.
They might opt for managing a condition instead of some aggressive, expensive surgery.
Exactly. And because less money is being spent, the algorithm looks at the data and it assumes the older patient is at a lower risk than they actually are.
So you could literally be denied access to a care program or even insurance coverage, not because you aren't sick, but because the math decided you aren't expensive enough to matter.
That's the practical and scary result. The senior techie highlights how this leads to seniors being systematically underrated. It creates a completely false picture of your health.
That is just wild. And it's not just the back-end math, is it? It's the screen right in front of your face.
Oh, absolutely. The user interface, the senior techie points out this is still a huge barrier. We see patient portals with really confusing navigation. It just assumes a high level of tech fluency.
And it can be dangerous. I saw that when they tested those popular symptom checker apps.
They frequently failed. They failed to detect really serious conditions in older adults.
Because the app doesn't understand how symptoms might show up differently for our demographic.
Right, or they just perpetuate the stereotype that seniors are less capable of making their own decisions, so the app simplifies things to the point where it's useless.
It really makes you realize that, innovation isn't really progress if it's leaving so many of us behind.
Absolutely. Which leaves us with a really provocative thought to end on. If AI is going to determine who gets care based on data, how do we make sure that our lived experience is included in that data? Because right now, silence in the data. It translates to silence in the doctor's office.
Something to really think about. This podcast is brought to you by The Senior Techie. It's available on Apple Podcasts, YouTube, and Spotify. If you'd like to keep up with their newsletters, you can subscribe for free by going to subscribe.theseniortechie.com.